I will teach you the latest classification of breast cancer, and I will teach you microscopy, gross and microscopy, the most important gross and microscopy of each type. So let me start without wasting time. Before coming on the classification and microscopy, you should understand the normal structure of the breast. So if you understand the normal breast structure, understanding microscopy is a fun for you. So let me tell you normal breast structure. We all know that breast is a modified skin appendage. It is functional in female during lactation, but it is rudimentary in males for always. For always in males, it is rudimentary. It has two components. Can you see the diagram of a breast here? You can see the diagram of breast. Yes, you can see the diagram of breast. I would like to draw one diagram for you to explain you. So this is the breast, this is the nipple of the breast, and this is the diagram of the breast. So you can see the entire breast. The entire breast has multiple ductules inside it. These are the small ductules or acini. So whole breast is made up of these ductules and acini. These ductules and acini opens in terminal ducts. These are known as terminal ducts. Terminal ducts. All of them open. Multiple terminal ducts opens in lactational duct. This is one of the lactational duct. So this happens throughout the breast. I am drawing only in a portion. So this is lactational duct. So lactational duct opens in the nipple. Just before opening, it has a dilatation which is known as lactational sinus. Milk collects here and then it opens in the nipple. So it happens for all. So these are the terminal ducts. Ductules or acini opens in terminal duct. Terminal duct open in lactational duct. Lactational duct opens in nipple, lactational sinus, and lactational sinus opens in nipple. So this is how the whole breast is formed. This is the main epithelial component. Now listen, when multiple, again I am telling you, multiple ductules open in terminal duct. This is known as TDLU, terminal duct lobular unit. This is known as one TDLU. So TDLU is the functional unit of the breast. The functional, like the functional unit of the kidneys, glomerulus, functional unit of the lungs is acini. So functional unit in the breast is TDLU. You should know the full form, terminal duct lobular unit. Done. So that is the terminal duct lobular unit. So that is one आपका TDLU, multiple ductules opening in one terminal duct, and multiple terminal ducts opens in lacticiferous duct, and lacticiferous ducts open in the nipple via lacticiferous sinus. So milk is formed for the baby during lactation inside the breast of the mother. Milk is formed inside these ductules. So these ductules are lined by cells. Let me draw the cells. So these ductules are lined by double layered cells. Double layered. The inner layer is epithelial and outer layer is myoepithelial. All these ductules are bilayered. Inner is epithelial and outer is flattened myoepithelial. So all of them are bilayered. That is known as epithelial component. This is all epithelial component. That is ductules, then terminal ducts, then lacticiferous ducts, lacticiferous sinus. All this is epithelial component. The background, look at the background. Just a second. Okay. Oh, it is gone. So I will show you the background here. So look at the background. Yes, look at the background. Can you see the background here? The background is known as stroma. So in short, breast has two components, epithelial component and stromal component. You can see it here also, in this diagram also. Beautiful diagram. Can you see the yellow colored stroma? It is basically fat. So the background is stroma. Background is stroma, and apart from stroma, you can see these ductules. These are the ductules. Multiple ductules opening in terminal duct. The terminal ducts are opening in lacticiferous duct. This is lacticiferous sinus, and it is opening in the nipple. So milk is formed here. Milk is formed here in the ductules by the bilayer double lining. So milk will come to the terminal duct, then milk is coming in the lacticiferous duct, milk is collected in the sinus, and when baby sucks the nipple of the mother, milk goes in the mouth of the baby. So this is how whole process of lactation takes place. Have you got it? Have you got it? So this is the theory written. So entire breast is divided into 20, almost 20 lobes. Lobes are divided into lobules. Each lobules contain multiple ductules. Ductules are small circular structures inside which are lined by bilayered and inside which milk is formed, and they open in terminal ducts. This is known as TDLU, the functional unit of the breast, that is terminal duct lobular unit, and they open in lacticiferous duct. Lacticiferous duct opens in lacticiferous sinus. Lacticiferous sinus opens ultimately in the nipple. So this is the whole process how milk is formed and it is delivered ahead. So this is the same diagram showing, giving the same information. This is one TDLU, you can see. I'm marking here. This is the TDLU, you can see. So let me zoom it out this diagram. Can you see? These are ductules. One ductule, two ductule, three ductule, four. So multiple ductules which are opening in one terminal duct. This is one lobule, you can say. So this is one lobule, or this is one TDLU. And see the lining. Let me cut it out and show you the lining. Can you see the lining? It is bilayered. This is the inner layer inner layer of the cells of the ductus, which is epithelial, I am marking with red. And this is the outer layer. Can you see the outer flattened cells here? The outer flattened cells here. So this is outer layer, which is myoepithelial. So epithelial is inner and myoepithelial or fibroblast is outer. So all of them are bilayered. So beautiful diagrams, beautiful. And all breast cancers occurs in epithelial component. Epithelial component, not in stroma. Not in stroma. Background is stroma. Background is stroma. So there are the two type of lining here also to see. So can you see the inner lining? Let me show you the inner lining. This is inner lining, that is epithelial. I am marking with yellow, and that is outer lining. I am marking with red. The flattened cells here. So inner and outer. Here also these are the inner and these are the outer. So inner and outer bilayered, inner and outer. So inner lining epithelial component ka marker is EMA. You can highlight it using EMA, and outer ka marker is SMA or S100. These are the ISC marker which highlight particularly that layer. So that is bilayered, we got it. So epithelial component and stromal component. Stroma is 90%, epithelia is only 10%. Okay. So that is stroma. Let me move ahead. Coming on breast cancer. So that was the brief introduction about the anatomy of the breast, about the anatomy and normal histology of the breast. Coming on breast cancer classification. Now breast cancers are of two types, non-invasive and invasive. Very important. Non-invasive breast cancers, also known as in situ, because they are non-invasive. It is known as in situ carcinomas. And the second are invasive. So non-invasive and invasive. Each of them again two types. Ductal, lobular, ductal, lobular. What do you mean by ductal and lobular? If carcinoma is involving a duct, it is ductal. If it is involving a lobule, it is lobular. What do you mean by that? I will explain you. So see this diagram. You now understand this diagram. So it is a duct. If carcinoma is involving a single duct, it will be ductal. If it is involving entire lobule, multiple ducts which open in single terminal duct. If the carcinoma is involving entire lobule, it is lobular. So ductal, lobular. Ductal, lobular. That is the meaning. Have you got it? So see here. One duct is involved. See this diagram. One duct. Tumor cells are traveling in one duct. So this is ductal. Tumor cells involving the entire lobule. Entire lobule. Can you see? Entire. Multiple ducts opening in one terminal duct. So entire lobule is involved. So this is lobular. So this is ductal type, and this is lobular. So you got the meaning of ductal and lobular, I guess. So let me explain you the meaning of non-invasive and invasive now. Non-invasive also known as in situ, and the second is invasive. Ductal, lobular to समझ गया तुम्हें. Non-invasive, invasive समझने के लिए, can you see this is one of the duct? Please everyone concentrate on the screen. I am trying my best. So this is the duct. You can see this is the lumen of the duct. Let me talk about the lumen. This is the lining, inner lining, epithelial. Inner is epithelial, outer is myoepithelial. So this is the inner lining. You can see the epithelial cells here. You can see. So first they undergo hyperplasia. Can you see the cells become multi-layered? They are becoming more hyperplasia, more multi-layered. They become dysplastic then. So it is that dysplastic cells filling the cavity, filling the lumen. Dysplastic cells. These are tumor cells, but present within the cavity. Tumor cells are not coming out. They are present within the cavity. So it is known as non-invasive or in situ. So in situ is within the duct. It is present within the tumor cells are present within the lumen of the duct. They are not breaching and coming out in the stroma. They are not yet coming out of the stroma. So this is in situ. But see the next diagram. See here cells start coming out. If you zoom it out, here tumor cells are coming out. They will come out in the stroma. Where they will come? They will come here in the stroma. They will come here in the stroma. So this is known as invasive. Invasive. And in between the two, this is micro-invasive. So non-invasive and invasive. Non-invasive, have you got it? The same diagram. Can you see? This is a ductule. This is a ductule. And this is the lining. This is the lining of the ductule. Lining, epithelial cell. And this is the lumen in the center. These cells are normal. They become dysplastic. They become tumor cells. So they fill the cavity. So all the tumor cells are filling the cavity only. They are not coming out. So this is known as in situ. In situ. And when they breach the basement membrane and come out, they are coming out in the stroma. It is invasive. So I guess you got it. So you got the meaning of non-invasive, in situ, and invasive. If non-invasive occurring in duct, it is ductal. Occurring in lobule, it is lobular. Invasive occurring in duct, it is ductal, and occurring in lobule, it is lobular. So if you understand the meaning of all, I will tell you 4 diagrams, 4 microscopic pictures for each of them. And in the end, we will revise and compare them. Very beautifully, I have explained it very easily. So listen, first talk about non-invasive. I will teach you ductal and lobular. Then I will jump on invasive. I will teach you ductal and lobular. Let's see. So let's start with non-invasive first. So non-invasive in situ breast carcinoma, as I have told you, 2 types. So let's talk about ductal. One more thing. What is the short form of each of them? So this is known as in situ carcinoma. In situ. that is ductal carcinoma in situ, DCIS. This one is known as DCIS. This is lobular carcinoma in situ, known as LCIS. So these are standard short form. If I say DCIS, LCIS means I mean these two. So DCIS is ductal carcinoma in situ. LCIS is lobular carcinoma in situ, and these are invasive carcinomas. Invasive carcinomas. So invasive ductal carcinoma IDC and invasive lobular carcinoma ILC. So the four tumors DCIS, LCIS, IDC, ILC. I will teach you one by one. Let me talk about DCIS first. The first I am starting is DCIS. Then I will teach you LCIS. पहले in situ खत्म करेंगे. Starting with DCIS. See, DCIS. About 25% of the patient with DCIS convert into malignancy in the next 10 years. Let's see. This is the diagram of, I'm really sorry. This is the diagram of DCIS. You can see the first four diagrams. Don't see the last one. See the first four. DCIS has four patterns. So this is a duct. This is the lumen of a duct filled with tumor cells. So tumor cells, if entirely filling the lumen, so it is known as solid pattern. See, tumor cells are entirely, dysplastic tumor cells are filling the lumen of the duct entirely, pack to pack. This is solid pattern. In the second pattern, tumor cells are present at the periphery. They are present at the periphery, and at the center there is necrosis. At the center there are no tumor cells, it is necrosis. It is known as comedo pattern. The third is papillary. Tumor cells are present in the form of papillae, finger-like projections. Can you see the finger-like projections? So tumor cells are arranged in the form of finger-like projections coming towards the lumen of the duct. So it is known as papillary. And last is cribriform. The word cribriform means channi. You know chai channi ki channi. So it is like channi. Small holes are there in between. So tumor is filling the cavity of the duct, forming small holes or spaces in between. So this is known as cribriform. So tell me the four patterns. Who will help me with the four patterns? What are the four patterns? Yes, anyone among you? So this is the first pattern, this is second, this is third, and this is fourth. Okay, let me draw. So let me name them. So it is solid, the first one, comedo, the second one, then papillary, the third one, and cribriform, the fourth one. I will draw tumor cells inside them. So if tumor cells are filling whole cavity, whole cavity, it is solid. If tumor cells are present at the periphery, and there is necrosis at the center, it is known as comedo. In papillary, tumor cells are present in the form of papillae. Tumor cells are arranged in the form of papillae. In cribriform, tumor cells are arranged forming holes in between. So out of these four patterns, the first two are high grade, that is solid and comedo, and papillary and cribriform are low grade. So DCIS is of two types, high grade DCIS, low grade DCIS. So these are the four patterns of DCIS. In each of them, tumor cells are within the duct. They are not coming out in the stroma. That's why it is known as in situ. But it is inside the duct. So it is ductal. So these are the four patterns of ductal. I hope you got it. So in the diagram, you can see multiple ducts are there. All of them are showing solid pattern. Mostly it is solid pattern. So multiple ducts, there is no invasion. So you can see. So DCIS, the four types of DCIS, papillary, cribriform, solid, and comedo. Out of these, two are low grade, papillary and cribriform. Two are high grade, solid and comedo. So that is the thing, that is the summary till now. Coming on the next tumor, LCIS, lobular carcinoma in situ. So if lobular carcinoma in situ is present in any patient, about 25% of them will convert into malignancy in the next 10 years, and it is mostly bilateral. Bilaterality is and multicentricity is more common here. Let's see. Here only one pattern is there. The last one you can see. Here there are no four patterns like DCIS. This is the diagram of LCIS. Only one pattern, that is solid. All the tumor cells are arranged inside the ductule in a solid form. You will say, ma'am, what is the difference between this and this then? Solid pattern of DCIS and solid pattern of LCIS. There is difference. See the cells. Cells are more compactly packed in DCIS, in solid pattern. And here they are loosely arranged. Cells are far from each other. They are loosely arranged. In LCIS, they are loosely arranged. And it is a lobule, it is not a ductule. The main difference, it is a lobule. That's why LCIS. This is a ductule. That's why DCIS. This is a lobule. That's why LCIS. So these are the main differences. So here only one pattern is there, filling up the terminal ducts and lobules rather, and the cells are uniform, small, round, and they are loosely packed, loosely cohesive. So that is the difference. So we have done DCIS, we have done LCIS, we have done the two tumors. Non-invasive, ductal carcinoma in situ, lobular carcinoma in situ. That is, both of them are non-invasive type of breast malignancies. See the age. DCIS occurs relatively older age. LCIS occurs relatively younger age. Incidence wise, DCIS is more common. It is 5 to 10%. LCIS is less common, 2 to 5%. Clinical signs, DCIS present with pain, mass, and discharge from the nipple. Some whitish discharge will come, or transparent discharge will come. But here no symptoms will be there. On mammography, calcifications are seen in DCIS, but nothing will be seen in LCIS. Multicentricity and bilaterality. I will explain you the meaning of multicentricity. Bilaterality means occurring in both breasts. If it is a left breast, in future it will occur in right also. If it is presenting first in right, in future it will occur in left also. So bilaterality is more common and multicentricity is more common in LCIS. These are not very common in DCIS. Very important MCQ. Please learn it. Both of them can convert into malignancy in future. Both of them are pre-malignant. So once the tumor cells breach the basement membrane, they will come in the stroma and they will be converted into malignancy. Here malignancy is ductal, here malignancy is lobular. So let's see. So we are done with the first two. Ductal carcinoma in situ, the 4 patterns: solid, comedo, papillary, cribriform. Lobular, only 1 pattern, solid. And we know the differences between them. Coming on invasive carcinomas. I hope you are enjoying, liking it. Yes, I'm simplifying it as much as I can. So invasive carcinomas, again 2 types, ductal, lobular. The 2 types, invasive. Let me talk about ductal first. Ductal. So ductal carcinoma in situ, invasive ductal carcinoma, IDC. So I will talk about IDC and ILC. First, I will talk about IDC, invasive ductal carcinoma, then invasive lobular carcinoma. IDC is known as IDC NOS. NOS means not otherwise specified. So the meaning of NOS is not otherwise specified. It is known as simple IDC. So this is the diagram. What you can see in the diagram? What you can see in the diagram, I will explain you. Very easy, very easy. Don't worry, I will explain you. So can you see what it is? Someone can say what it is. You will see, ma'am, it is a DCIS. In which in the center there is necrosis. It is comedo type of DCIS. Just now you have taught us 4 type of DCIS. So it is comedo type. Yes, you are right. What it is, what this structure is this? You will see, ma'am, again it is a DCIS, but it is solid type. It is solid type. So comedo type of DCIS is seen. Solid type of DCIS is seen. Okay, got it. What these structures are? It is a normal duct, you will say. This is also a normal duct. Okay, got it. What these structures are? Who will tell me what are these structures? These one, these cells, individual cells, these one. So you will say tumor cells from DCIS, comedo, solid, whatever DCIS is there. Tumor cells are infiltrating and coming in the stroma. See the background stroma. Again, I will show you. Okay. See, try to see the background stroma. So this is all background stroma. So tumor cells, I have marked the tumor cells here. Tumor cells are coming in the stroma and they are present individually also and they are present in clusters also. So tumor cells coming in stroma, present individually and in clusters. So stromal invasion is there. They are leaving the ducts and coming in the stroma. So that's why it is known as IDC. So either the tumor cells are present in nest or cots or poorly formed structure, or individual tumor cells are present in the stroma. So that is IDC. So this is the real diagram. You can see multiple DCIS and some of the tumor cells are infiltrating in the stroma, coming out of DCIS and present in the stroma. So this is the diagram of IDC. Coming on the last, ILC, invasive lobular carcinoma, the last one. This is the diagram. Who will explain me this diagram? Who will help me in explaining this? Listen. So this is what it is and what it is. What are these 2 structures? You can say, ma'am, it is in situ. In situ, which in situ? It is lobular in situ. It is lobular in situ. So just a second. It is lobular, LCIS, lobular, because the cells are cohesive na, loosely cohesive. It is solid pattern, लेकिन solid उसका एक ही pattern था. LCIS का एक ही pattern था. So it is a lobule and it is LCIS. Cells from this are coming out in the stroma. See the background stroma. Try to see the background stroma. Again, I will show you. This is all background stroma. So in this background stroma, can you see these cells? These cells are coming out of the LCIS and they are arranged. How they are arranged? वहां पे कैसे अरेंज थे? क्लस्टर्स में और इंडिविजुअली. यहाँ पे कैसे अरेंज्ड हैं? वन बिहाइंड द अदर. सो इन अ रो, इन अ लाइन. Cells are typically arranged one behind the another in stroma. The cells which are present in stroma, they are typically present one behind the another. This pattern is known as Indian file pattern. Indian file pattern means one behind the another. Can you see? Can you see this Indian file pattern? So it is one behind the another. So see, cells are showing Indian file pattern. Please learn this for MCQ. Indian file pattern, one behind the another, like a school row. So one behind the another. So typical Indian file arrangement is there. So that was all about it. That was, now compare the two. So this is IDC IDC, you can see invasive ductal carcinoma. This is ILC, invasive lobular carcinoma. The two diagrams are in front of you. So here, just a second, here you can see DCIS Comedo type and DCIS solid type. Multiple types are there. Now here only one type of LCIS, that is solid. So here you can see DCIS, here you can see LCIS. Now cells from the DCIS come out in the stroma and cells from the LCIS come out in the stroma. So making it invasive. From in situ it got converted into invasive. But here there is no particular pattern. They are present in clusters individually. Here there is a particular pattern known as Indian file pattern. I tried my best. If you got it, it's good. If you don't got it, I don't know what to do. So I tried my best. Anyways, the tumor here, the second one I am talking about, ILC, invasive lobular carcinoma. There is a specialty. It is usually bilateral and multicentric. Bilateral, it occurs in both breast, right and left. So if the patient is having invasive lobular carcinoma in one of the breasts, ask the patient to do breast self-examination at least once a month or more frequently to see the tumor in other also. So that is the thing. Multicentricity का मतलब क्या होता है? What do you mean by multicentric? Now there are two terms, multifocal and multicentric. You know, we divide the breast. This is the female. Let me draw a rough diagram, sketch diagram. This is the thorax of a female. This is the sternum. And these are the two breasts. These are the two breasts, right and left you can see. Breast is divided into four quadrants. So these are the four quadrants. Both the breasts are divided. So this is inner quadrant present towards the sternum. And this is outer quadrant presents laterally. So these are outer quadrants. And the two upar wale are upper and two niche wale are lower. The two above are upper, the two below are lower. So the four quadrants in breast are upper inner, upper outer, lower inner, lower outer. So this is how breast is divided into four quadrants. Why I am teaching you this here? Why I have drawn this diagram? What is multifocal and multicentricity? I want to teach you that. Yes. Okay. So what is multifocal? If the tumor is present multiple sites but in the same quadrant, it is known as multifocal. And if the tumor is present multiple places but in different quadrants, it is known as multicentric. So the two terminologies are different. I tried my best. So see the diagram of multifocal, all the tumors present in one quadrant. Multicentric, tumor presents in different quadrants and the distance between them is more than 5 centimeter, at least 5 centimeter. Done. So multifocal and multicentric, because here in multifocal we do staging only once of the largest tumor. We will do the staging. In multicentric we have to do staging separately. So that is the reason you have to be sure enough. Done. So let me revise the four types. What are the four types? DCIS, ductal carcinoma in situ, LCIS, lobular carcinoma in situ. Both of them are non-invasive or in situ carcinoma. Then IDC, invasive ductal carcinoma, and ILC, invasive lobular carcinoma. Both of them are invasive. So let me first revise the in situ carcinoma. These are the in situ carcinomas. So ductal in situ carcinomas are of four types. The four types are in front of you: solid, comedo, papillary, and cribriform. And lobular is only one type, that is solid. You know the differences between them. And these are the diagram of IDC and ILC. Invasive lobular carcinoma, invasive ductal carcinoma, and both of them tumor cells are present in the stroma. But in the first there is no peculiar pattern. In the second there is a peculiar pattern known as Indian file pattern. Tumor cells are present in stroma. So that was all about these four types of tumors. So these four types, apart from these four, the fifth tumor in the breast is Paget disease. Paget disease is the malignancy. It is a malignancy. It is present in the breast. Paget disease of the nipple. So what is Paget disease of the nipple? Patient will come to you with eczematoid lesion over the nipple. So nipple, she is feeling itching. She is feeling that the female is feeling itching in the nipple area and she is having eczematoid lesion over the nipple. So she feels it is a dermatological condition and she will run to a dermatologist. She don't know she is having malignancy because inside the breast she can't feel any mass. So what is actually happening? Let me draw a diagram. So this is the breast of this female. This is the nipple. And these are the ductules, multiple ductules. These are terminal ducts. Terminal ducts are opening in a lacticiferous duct, and lacticiferous duct, lacticiferous sinus, and it is opening in the nipple. So actually what is happening here? There is a small tumor inside, small ductal tumor, IDC, but it is very small to palpate. So tumor cells are traveling along the lacticiferous duct. They are not coming in the stroma. They are traveling along, traveling. They are coming in the nipple. From the nipple, they are entering in the skin. In the skin, we have epidermis and dermis. So they are entering in the epidermis of the skin. Just a second. sorry. So they are entering in the epidermis of the skin, and it is producing a itching and eczematoid lesion in the nipple. So that is known as Paget disease. So patient is feeling she is having some itching and dermatological condition. Actually, it is a hidden tumor inside. So the same diagram showing here, it is less favorable. So the same diagram, you can see this is the tumor. Tumor cells are traveling here, the blue colored, along the lactiferous duct, and these tumor cells are entering in the epidermis. So this is epidermis. These are tumor cells entering in the epidermis. These are known as Paget cells. So Paget cells are the tumor cells which entered in epidermis of the skin, producing an eczematoid lesion there. This is how it looks. Done. So this is the thing. Tumor cells from underlying malignancy enter in lactiferous duct. They go in the nipple. They produce skin lesions there. Done. Should I proceed? So patient presents with crusting and fissured and ulceration. So patient is presenting like this. Patient is histologically, if you see, you will see Paget cells in the epidermis. That was all about Paget disease. So I tried my best. I guess I'm done.